Welcome to the podcast. Today we will be tackling the world of femtech, which is, for those that don't know, a relatively recently coined term, but a sector that hopes to address myriad women's health issues that have been previously somewhat overlooked by the technology space. Our guest today is Joanna Smart. For those of you that don't know Jo, her shining career has included executive appointments ranging from startups all the way through to billion-dollar global companies in both the UK and the US. And her 20-something years in the market have been spent doing things ranging from enterprising growth, corporate deal making, and the translation of technologies. And she's currently the non-exec for Verso Biosense, where she's recently stepped down as their CEO. So welcome, Jo. So before we get into maybe the wider subjects, I think for the purposes of those that may not know you, it would be useful to learn a bit more about your journey and what's brought you to working in this space and with Verso Biosense, if we may.
Of course, Rob. Thanks very much for chatting with me this morning. So as you as your introduction said, I have spent 20 years in life sciences, and I've worked with companies of all stages, but one of the other things I've done, and I spent over a decade working in this space, is the translational funding space. And this is through my work with the NIHR, which is the UK's largest funder of health and care research. And this is where I came across the academic founders of Verso. So the Eye for Eye programme funds specifically the development of innovative health technologies to translate them from the bench through to tangible patient benefit. So these guys were looking for academic grant funding for this as a project. So I first met them from the University of Southampton. I first met them through this program. And what drew me to the technology was a combination of some really interesting factors that you don't always find in the medical health technology space. So one of which was it was a really groundbreaking technology, the platform, and I'll talk more about that in a little while. The platform itself is fascinating, but it came about because of a clinical need. And it was actually a clinical question that was asked of an engineering team. This is one of the things that you often don't see. The origin of it was this unmet clinical need and a really important question that some really amazing technology could help to answer. So that was what really drew me to it. And then when I started reading more about it, about the space and about female reproductive health research in greater depth, I was really surprised to find there are some really fundamental questions about the basic physiology that no one knows the answers to. And that was the final piece, I think. I couldn't look away. This is a great piece of technology in a space that's really important.
Okay, perfect. And so from the purposes of Verso, I mean, you talk about the interesting technologies that they have. I mean, what's their sort of fundamental product that they have, and where are they? What are they fundamentally looking to tackle with that product that makes it as hopefully disruptive as many of these technologies in the sector?
Right. So the technology itself is a completely groundbreaking sensor platform. So what it does is it works deep inside the body, and it has no internal batteries and no wires, and it can monitor these physiological parameters continuously over a course of many days. And that's really important when you're looking to monitor biological systems, because what you don't want is to perturb the environment. So this is an indwelling sensor that can sit there, and it's biocompatible, and it can take these measurements over a long period of time. So it gives you this sort of 3D map of what's going on inside the body in real time, if you choose to have it in real time. So it's a really interesting piece of sensing technology. And the power is really interesting as well, because it doesn't have any batteries inside the body, but the power the system can generate gives you as much power as you would get from the smallest state-of-the-art batteries in that kind of system. So from a tech perspective, it's a really interesting piece of technology. And as I said earlier, it's about a clinical need. It's sitting in this case in the uterus, because the fertility clinicians wanted to know what the endometrial environment is like, because we've spent 40 years optimizing incubators for embryos in IVF, and we put this embryo, we culture it for 3 to 5 days, and then we put it into an environment that we just have no idea about. We have so little information about what's going on in the uterus. And so, of course, we don't understand why some embryos develop, why some of them don't, and why IVF can, in most cases, only works in 30% of cycles.
Yeah, I must admit, to draw on a somewhat personal perspective, my wife and I went through IVF, and it's obviously a phenomenal thing. We're very lucky we had a son, but there are so many questions and so many unknowns, and it is an incredibly difficult process for my wife particularly. I mean, I'm there almost as a bystander, but the reality is, from my perspective, is there's so many questions that she couldn't have answered for her by the data and the information the fertility clinics have, and so therefore this sort of thing, it seems incomprehensible that this sort of science hasn't already taken place. Now, one of the things to sort of lead on from that, before we discuss maybe some of the more key topics, femtech. Some people love the term, some people dislike it. Obviously, the Iderton coined it in 2016, so it is relatively new. For you, what does it mean as a sort of a term? What do you put femtech as? What does that mean to you personally?
You're right. It's a very broad term, and I think for me, it really covers any technology that addresses a health need that is either specific to or differently experienced by women. So anything from period tracking apps, and that, of course, is where Clue originally came in. And of course, they do so much more than that now. Novel contraceptives, pelvic health, breastfeeding, and long-term chronic conditions. So it's not just about reproductive health. It's about any technology that addresses a need that's specific to women, whether that's specific because you are a woman or because you as a woman experience different health conditions differently to men.
Now, you somewhat touched upon this when you were giving your introduction to what Verso does, and some people may or may not know that obviously when the FDA decided to exclude women of childbearing age in 1977 from drug trials, that obviously left a fairly fundamental gap in the industry's data, and that meant that the female populace really lagged behind in terms of the information that was available. So clearly all these technologies are trying to address something which hopefully will start to fill that gap. But how do you as an industry go about fulfilling what is essentially 30 to 40 years worth of data hole to redress the balance? How do you go about that? I know that's a big question, but where do you start?
It was a very, very good question, and one I wish I had an immediate answer to. I think, as you say, a lot of it has to do with the historical lack of information. And that's something that you can't, either overnight or even over many years, you can't backfill that data. But what you can do is look forward and look at the real world experience of both men and women with the drugs that are already on the market and new drugs that are being approved. And drug is sort of a catch-all, if you like, in this space. But you do see drug side effects, and the monitoring of drug side effects sits alongside the monitoring of device side effects. But as you say, there's this kind of big data hole. So this really came about because of thalidomide and the response to the terrible fetal effects of thalidomide, which meant at the time home pregnancy tests didn't exist. So it made sense to exclude women of childbearing age from all clinical trials in case there were these additional terrible side effects. So it made a lot of sense at the time. But the trouble is, it wasn't then used to understand the differences. So the drugs were then approved on the market for men and women. So what you end up with is approved drugs, and Ambien is an interesting example of this, where when it's in the market with lots and lots of different people using the drug, you end up with observed differences. And over time, as you amass that information, you can start to make retrospective decisions. So, for example, with Ambien, FDA decided to lower the dose specifically for women because they were seeing side effects the following morning, more of them in women than there were in men. So what you can't do is fill in that complete gap, but what you can do is look forward prospectively and start to look at these observations and analyze the data. And that's one of the key things that, to an extent, is still missing. So there was an interesting report done by Brigham and Women's Hospital it was probably about 6 years ago, that drew attention to some of these key areas. And one of the things that it highlighted was that a lot of clinical studies, even though they now have to include women, if they're NIH funded, and this is the US clinical trial funder for a huge number of them, they have to include women, but what they don't always do is include the analysis of those sex-related differences in the results. So what you don't see is what was observed in that clinical study. You also don't always get the right number of women recruited, so you might not be able to do that analysis. But again, it's all behind closed doors because they're not declaring that information. So what I think we can do is start to push to have that information disclosed. And it's not perfect. None of this information is perfect, but at least it's a start in it, starting to understand what these differences are. And part of it is about having the broader conversation.
Yeah. Okay. Well, yeah, and I think, as you completely correctly point out, it's impossible to fill a gap that is so cavernous, but ultimately you can try to address it as quickly and efficiently as possible. And it seems like the green shoots of this sector are starting to do that. Now, I mean, one area which I suppose comes as a bit of a shock to anyone, and it certainly did for me when I started to read more about female-specific technologies, and the fact that obviously women make up 51% of the population. There's a lot of feminine products in almost every other avenue that there could be, but yet technology lags so far behind. And I was reading the interview that Tanya Fowler did with the Telegraph recently, and one of the statistics was that it said that women are 75% more likely to use digital tools for healthcare than men are, which begs the question, why on earth is that market not being targeted? So given that all these unique women health-related technologies are now coming to market, what do you feel has stopped that investment, that resource being dedicated to those things, when so many burgeoning areas of medical technology are going forward and are reaching, really quite exciting heights, but it's taken this long for femtech, if that's what we're calling it, to get to even the starting blocks, it feels like now?
I think a lot of it has to do with a set of historical factors, which are to do with women not being involved in multiple different places in this ecosystem. And I don't think it comes from misogyny. I don't think it's intrinsically that there is a bias against women. I think it's simply the fact that there aren't enough female voices offering these suggestions and these ideas and bringing them to the table. So I think it has to do with diversity, but not as a feminist issue, but as a just as a lack of experience and lack of, therefore, personal understanding. So we all make decisions to a large extent based on our own experiences. So what we bring to the table as individuals has to have an impact on the decisions that we make. So I think it's a set of these factors where the perspective of women's health wasn't recognised, wasn't brought to the table, and so wasn't recognised as an investment opportunity. And I think that's one of the exciting areas that make me most interested in the women's health space, is because we're looking at investment opportunities that you don't see in other health spaces, because the investment hasn't been there and because the technology hasn't been there until recently. So the types of problems that you're tackling in women's health are some of the really big ones. And it's not that women's health problems are intrinsically more complex. It's just that we haven't really tackled them yet. And that, on the flip side, means that there are big investment opportunities because you can solve big problems with comparatively simple solutions. So, if you compare it to the field of oncology, so much work has been done that what you end up doing is you're seeing incremental improvements in areas where there's already been a massive stride forward. But in lots of areas of women's health, we haven't yet taken those big strides. So we're ready to take those big strides. So from an investment perspective, that's a really big opportunity.
Yeah, I mean, I was again reading that the Frost and Sullivan report from last year, although it was obviously pre-pandemic, which I guess will have had a little bit of a change of maybe what the suggested outcomes will be for future predictions. But they're talking about, investments reaching $9 billion by 2025, and just over $1 billion of revenue from 2024. So clearly there is a market there from an investment point of view, and I guess you're right in the sense that if you're a male investor, and unfortunately the market is not massively diverse, and the number of female investors are growing, but they're not there yet. And I suspect, as you say, it's that personal connection, isn't it? You see it a lot, I think, with the way that the founders are orientated. So if you look, and although there are exceptions, people like Peter Asprey, who obviously is tackling issues because of something he's encountered personally, but via someone he was talking to, rather than it being a direct personal, experience. But the reality is that most femtech companies are founded by or led by women. And one thing I would be interested to get your thoughts on, and from a recruitment point of view, this is an interesting factor actually. How do you stop a market like femtech becoming a niche product and a market where you almost have the flip side of diversity? So you end up with businesses that end up with a massively outweighing female populace and don't attract enough men into the businesses. You don't get enough men moving towards the top jobs or taking on or starting those roles. What could you do what can the industry do to stop almost the exact opposite effect that you have in the current medtech space then occurring in the femtech space? Is there anything you think might help that diversity level out across both sectors?
It's a really interesting point, and one that, I've been recruiting teams, I look very carefully at the way I think about recruitment and make sure I am not either positively or negatively viewing anyone because of these characteristics. And I think part of it has to do with approaching teams and approaching problems, and part of it comes from the candidates being interested in pursuing that particular avenue, solving a problem in this space. It has to do with all of us taking that very broad approach as we think about all of these opportunities. But it also has to do with education and understanding the size of the opportunities. So it's I rail against positive discrimination of women to be chosen because you are a woman. You should be chosen because you are the best person to do the job, and it shouldn't matter whether you're male, female, from whatever background. It doesn't impact how good you are at the job, and I think that's crucial. But I think it's partly about understanding that these are not niche areas. So it's not a niche market opportunity. These are massive market opportunities. Fertility affects 1 in 6. Fertility issues affect 1 in 6 couples around the world. That's not far off hypertension as a market size. These are big. So it's really important not to see women's health as a niche space. They're massive market opportunities, and therefore they're interesting for all of us to want to work in, to want to invest in, and want to develop products in, because we can make these changes. So I think, from the recruiters and the teams and the R&D teams, that makes it exciting to work in. And from a leadership perspective, you do need female voices to be heard, because you need to understand some of the issues that you encounter, but you need that balance. And I think you're quite right. You don't want purely female management teams for the sake of being female, because that's no more beneficial than only having men who lack that breadth of experience. So it is crucial that we don't end up with that situation where we invest in femtech because it ticks a box, and I think we've got to be very careful to avoid that.
Yeah, it's a difficult one, isn't it? Because you constantly want to raise the awareness of shortfalls in a market, and you create this buzz around a term, and it is affixed to the term femtech. But I think exactly like you say, it's important that people don't get too wrapped up in it and don't go, right, well, because ultimately I think part of the issue is that, and I think Tanya Boller actually mentioned it, when she went to look for investments, people told her what she was pitching was too niche. Yes. But yet what she was pitching at applied to over half the population. How can that be niche? So really, femtech isn't a term that should exist. It really should be tech for humans i.e. medical technologies, and it should almost not be a subcategory. But equally, if it isn't, then you can't raise the level. So you have to sort of accept that it can be a positive thing, but avoid the negative connotations as well. But ultimately, people are talking about it. There's articles in the New York Times, there's articles in the Telegraph. That wouldn't have happened, 2 years ago even, I wouldn't have suspected. So it is on a positive trajectory. So look, I mean, I think we've tackled some of the core things, and look, we could talk for 4 hours about all the ins and outs of what makes it a great industry and why people should want to work within it. I think there's a lot of things which the listeners will be interested about what you've said. But look, let's assume that things are going on a very positive trajectory at the moment. There, as we've discussed, are lots of hopefully investment potential coming their way. The revenue projections are high. How does the sector go about fulfilling that potential? What does it need to do to not be one of those things which people get excited about and then it loses momentum? How does the sector continue to gain more and more investment, to gain more and more notoriety and continue to grow, from your point of view anyway?
I think it's going to be important to think about several things, one of which is, as we just talked about, separating the issue of diversity and women's voice from women's health. They're both important, but they don't have to be tied together. And I think that's one of the reasons why women's health is an exciting space, because people are starting to recognize that there are opportunities there, but it doesn't depend on being led by women. It doesn't depend on being a diversity issue. So I think that in terms of the women's health space and femtech, that will lead to a much longer term, much more stable space within the industry, to create its own vertical, if you like, to separate it from being an issue, to make it into an opportunity within the market. I think, as we talked about earlier, some of the people sometimes refer to low-hanging fruit in terms of investments and products and opportunities. I think realizing some of those is going to be important. So a lot of it has to do with building some of these successful businesses and then investors seeing exits from those successful businesses. Now, we are seeing more and more exits in the femtech space, but we need to continue to see those and continue to see the success, because that's really ultimately what prompts further investment in the earlier stages, because you can see a track record of investments in that space have been successful. So I think that's important. And I think it's really to do with capturing how big these opportunities are. If half the population are going to suffer at some point in their lives from menopause, then that's a big opportunity. And that's really where we should be looking to target some of these major health advances, because it's a big market. So I think it really has to do with focusing on how important this is as a market and taking out some of the issues that you can address and should be addressed within the space, but also about focusing on exactly the same metrics that we use in other health spaces in terms of investment. I think that's really what's going to prevent it being a bubble and make it a long-term, really exciting space. And ultimately, the reason I'm in this and the reason I'm involved with Verso still and a number of other businesses is because it's about evidence-based medicine. So the more we can bring evidence-based medicine to women's health, the greater the difference we can make. And that's really what's going to transform both the health of the of 50% of the population, and it will have knock-on effects to male health as well, because we understand the diseases better. But it's also about making sure that we're solving these problems and taking the investment opportunities.
Well, I think, that's a great summary. And I think my hope for things like this, I think, and maybe part of the reason that femtech and various other things, I've engaged with a number of mental health businesses, and I think we've talked about this previously, is that maybe the sort of social stigma that would have once come from men talking about female issues, or men talking about their own mental health issues, or if it happens to be infertility in men or whatever it happens to be, now it seems that those social barriers are coming down, and where we've got to with femtech, I hope will be something that can be replicated in other areas where potentially there has been a social stigma, and that's prevented investment or whatever else. progressing those technologies to a level where really they should be for the human sustainability that the market claims to be pushing towards.
I think you're right. I think taboo subjects are the cause of a lot of failures in our collective ability to solve health problems, because we won't talk about it. And my own experience of speaking with investors over the last 4 years, it's changed. It's so much easier to have the conversations this year than it was 4 years ago to talk about female reproductive health. There's a lot less discomfort on the other side of the table when you start talking about menstruation. It's really important to be able to talk about these issues just in exactly the same way that we talk about cardiovascular health.
Yeah.
And mental health is a really important space and a really important parallel. So I agree. I think it would be great if we can extend these the conversations to other areas where we're less comfortable talking about it.
Super. Great. Well, look, thank you very much. I think it's been a really interesting topic of conversation. As I say, I would quite happily talk about this for hours with you. But hopefully it's been something which has given people cause for thought. Maybe some of the investors that have been out there will get a little bit more of an insight into what goes on there, and will make them think about potentially next time they're going through their portfolios, how they might potentially diversify, and hopefully it brings a bit more spotlight onto what is a hugely exciting area and an area which has a lot of human good ahead of it. So look, thank you very, very much for your input. It's been greatly appreciated, and we look forward to getting the comments of our various listeners as well.
Thank you, Rob. Really enjoyed it.
No problem.